Welcome to this week's edition of Health Check, where my colleague Dr. Nosipo and I give you a weekly reminder to check in on your health. Join us in conversation on all our social media platforms at HealthCheckSA, where we engage on health matters. We wanted to get a better understanding on how well the workspace has adapted to accommodating various mental health conditions. More specifically, we're focusing on bipolar disorder. The condition is associated with episodes of mood swings ranging from depressive lows to manic highs. And my trusted colleague, Dr. Nosipo, has managed to spend some valuable time with someone who's willing to share their story with us.
Today, we're in Roodepoort, where we're about to meet Nongceba Jika, a middle-aged mother of one whose family has had a lifetime of dealing with different mental health conditions. Let's go hear their story.
The only thing is that my mind is running at a rapid pace. I feel to a point I can't even keep up with my own mind. And then I kept saying, I'm not hearing voices, I'm not seeing things. My mind is racing, I cannot sleep. And I'd be crying and crying. I'd even be praying, say, God, you said you will never sleep nor slumber so that we may sleep. That is all, I just want to sleep. My name is Nongceba Jika. I work for the National Development Agency as what we call a development practitioner. My official diagnosis came in 2008, and it came as bipolar mood disorder 1.
Thank you so much, Mama, for having us in your home, welcoming us. Now, can you tell us, to start from the beginning, what is your family's history with mental health?
With my mother, it was in 1993 that she once came home. When I say home, that's where I was brought up by my grandmother. So my dad brought her back because she was sick. And I came back from school, and she picks me up. She tells me that her life is in danger. My life is in danger. We go to the police station. So then, through that experience, I then went into a psychiatric clinic. I then learned more about it. So that's how she got to open up, and she got her diagnosis as schizophrenia. But they called it major depression at the time. But over the years, they then said schizophrenia, and they got to give her the correct medication because we struggled for a number of years.
But when your mom started getting sick, how did your life start to change after that? Because I'm sure she was different before, and there must have been a change after.
I remember thinking to myself, if it was said she had cancer, then people would sympathize or empathize. But with something like this, how do you explain what is wrong with your mother when she's breaking the glass of, what did you call those stands? The TV
room
stands.
divider.
The room divider, yes. Yeah. And when she now starts thinking that I want to kill her because I want her husband to, where do you go? Because really before the diagnosis, nobody knew how to help her. I myself did not know what was wrong with my mother. I just knew that something was not right.
And I'm sure that made it difficult for your family and the community. And going now to 2002 with your own experience where you did mention something traumatic happened to you. Before that time, had you had any issues with your mental health?
I would have strange dreams. I would be sitting in a class and like, my head is aching, somebody's got a headache, you are killing me. Things like those, but I could never really put it together. So I never really considered it to be an issue of mental health. I probably thought just I am running away because I don't want to be a sangoma. I'm running away from the calling. When
did you start noticing that something was changing about you?
I still could not finger it. It was when I had this full-blown episode in 2008, where I was now hospitalized in 2008, that I actually had a name put to this thing. So, yeah.
And can you tell us what happened during this episode in 2008?
When I look back at it, I think it makes sense, but at the time I could not articulate it well. I had a church lady who had cancer that I then happened to ukunyanga again, to nurse again.
Okay.
Yeah. Oh, it's almost like my brain was trying to tell me, go see Mapito, but I could not put the dots together. I felt I had the cancer. So by the time she gets to the parking lot, I am all over the place. I was also wearing a strapless dress. Yeah, I feel like there are worms in my breast. Yeah, it was a whole thing. Then that's how, luckily by the time he came, he could tell from the phone that I'm not okay. So he got a friend of his to come fetch me. Then then he then drove my car, and then the friend drove the other, and they took me back home to my mother. And the phrase I'll never forget was, you are your mother's daughter. You are as crazy as your mother is. So yeah, that's how I can sum up that episode, 2008.
And then you were admitted to?
I was admitted, yeah.
Okay. How long was that admission?
I want to believe it was 6 weeks, because I had left my job, which means I had no medical aid anymore.
Was this Wanjanige after you finally got a diagnosis? Because you've been battling now for some years with no official diagnosis.
More than me feeling it, I'm going to refer to one of the few people that I told. He went and said, oh, my little bipolar. So that's what you are. And my sister took such offense to say, it's not like my little pumpkin. This is serious. But to me, I was not looking at it in that light. It was looking at somebody who says, oh, okay, now we know. Now what's the next step? And the next step was now trying to live with it and do the best that I could with it, yeah.
So they started you on medication after this episode?
Yes.
And how was life like after now? So how were things going?
So to the family, I would always feel like they think I'm lazy. You know, when you are just stuck in bed and you can't wake up and you just want people to draw the blinds and just keep you in this dark room. That's how I initially then got to get used to the treatment, but it wasn't nice. Yeah, it really wasn't nice, especially because at the time I was given haloperidol. And then I kept saying, I'm not hearing voices, I'm not seeing things, my mind is racing, I cannot sleep. And I'd be crying and crying. I'd even be praying, say, God, you said you will never sleep nor slumber so that we may sleep. That is all, I just want to sleep. So yeah.
So nakona besegunzima because they started you on the wrong medication.
Yes, I got the wrong medication for the condition that I had.
And how long did it take for them to eventually realize they needed to change your
The
treatment?
thing is that I had a cousin who also had issues, mental issues. She was on an injection and she was on Atrex, I believe it was. Then she hated that Atrex and then said to give me that Atrex. So I self-medicated, which I know is wrong, but all I needed was to sleep. So then having slept, I was able to go to the doctor to say, here is something that helped me. So based on that conversation, they said, okay, let's relook at what it is that we are busy dealing with. And then that's when they put me on Epilem, and then they put me on Tripoli.
Having gone through various treatment options for her bipolar mood disorder, it's clear that treatment will vary from patient to patient. But Dr. Sillo, what exactly makes bipolar so difficult to treat?
Coming up next, we hear from our expert clinical psychologist and continue our health check-in with our mental health patient. Welcome and thank you for staying tuned. While the cause of bipolar disorder isn't exactly known, there are numerous symptoms to look out for. Manic episodes may include symptoms such as high energy, reduced need for sleep, and loss of touch with reality. Now, to help us get a better understanding of mental health and in particular bipolar disorder and how it's handled at the workplace, I'm joined now by Kitumetse Dumi Mashiko, who's a clinical and sports psychologist and founder of Riba One Wellness. Welcome to our show.
Thank you so much for having me.
All right, so we call you Dr. Tumi.
Yeah, that's Tumi is also fine.
All right. So we're talking about in a broad range of issues around mental health.
Yes.
Perhaps let's start by defining what a mental health condition is.
Mental health is basically something that interferes with your daily functioning, right? It's pathology that involves usually the brain chemistry. And it's because there is an imbalance there that causes it to manifest, for example, as depression or whatever, bipolar, schizophrenia, whereby you find someone actually manifesting physically in a certain manner or struggling with certain things physically, outwardly. but it's because of the imbalance basically in the brain, in the mind.
So there's obviously quite a range of these mental health conditions.
Definitely, yes.
Perhaps just keeping it at, that general kind of level.
Okay.
Is it a problem in our country?
Definitely. I think with a lot of stress, we've got a lot of stress here in South Africa, for example. We've got load shedding, we've got, job losses, unemployment. We've got a lot of issues happening, impacting everyone, the youth, everyone, right? So that stress, ongoing stress, is one of the causing factors that can lead one to develop a mental illness or mental health disorder.
Right. I'd like us to come back to that issue of, the stress and the possible causes. But let's just understand the extent. Do we perhaps have figures, for instance, in the country to show just how many people are affected by mental health disorders?
They range on a continuum. Right, so you can have people who, for example, have adjustment issues, right? But you do have those who have severe pathology. I'm of view that over the years it has been increasing more and more. Even looking at the suicide rate, right, it has increased immensely in the youth, especially, which is sad. So I think there is over the years been a severe increase, whereby you find, there is a lot of people presenting, and some unaware. Some do not know where to go for help. Some are in denial. Some, just do not understand what's happening to them.
So let's come back to then perhaps more specifics in terms of your own experience.
Yes.
Which are some of the commonest, conditions that you come across?
People usually who come see me are usually those who are clinically depressed, meaning that they will probably need admission or medication from a psychiatrist and other interventions. But I do also get your bipolar. The different types of bipolar. We've got 2 types, and your schizophrenia, where someone is lost touch with reality. You do also get people with symptoms that don't meet the full criteria for a mental health disorder, but present with severe criteria, right? Some of the criteria. So they don't get the full diagnosis, but they do have symptoms of mental illness.
So talking about bipolar disorder then, you mentioned that, obviously someone needs to meet certain criteria for diagnosis. In describing what bipolar disorder is, can you perhaps just differentiate between just someone experiencing feelings of, just being low and feelings of being high and, excited about something? Differentiate that from the symptoms of the disorder, bipolar disorder.
So with symptoms of any mental health illness, but specifically bipolar, you get, it's more than just sadness in that the person has been low for over 2 weeks. If it's mania, because then there's different types also of mania. There's also the one where it's 3 days, where it's hypomania, then where it's slightly less it doesn't impact your daily functioning as much as the full-blown mania, where it can go from a week to about 2 weeks, where someone is not sleeping. So it's more than just feeling happy in that this person has high energy, flight of ideas. They've got ideas for days, and even pressure of speech. When they speak, you can hear, and then they've got solutions for everything, and they actually do not want to sit. They are restless, and they're not sleeping. And then at some point they hit a low. And then the depression phase is also more than just sadness in that it impacts the daily functioning. So when we diagnose, we must ensure that it impacts your daily functioning, because as you rightly mentioned, sometimes we have sad days, sometimes we have low moments. But when it impacts your daily functioning, you cannot get up, you cannot take care of yourself, you're not bathing, you're not doing the things that you love, then it means that it's more than just just the low, the blues, yes.
So how regular are those swings? And do they differ in terms of regularity?
Yes.
Sometimes you'll have more lows than highs, or vice versa?
It just depends on the individual. So some people have more manic episodes, or you see that they're not well when they have a manic episodes. Some is vice versa. You see it when they have the depressed mode, right? And some actually, sadly, it becomes a psychotic process, meaning they lose touch with reality and they actually start to have delusions, or hear voices, or become very paranoid. So unfortunately, with mental health illness, especially when there's no intervention, you progressively get worse. So the episode today will look something worse if left unattended to when it happens again or recurs.
I guess, on that note, it's important that, someone consults,
Definitely.
early enough so
Definitely.
that treatment, is started early.
Definitely.
Are there any challenges in making an early diagnosis, for instance?
Yes, there's a lot of denial,
Right.
but that's also part of the diagnosis. People, I think, when they are diagnosed with it, they go through the phase of denial before they accept. So there's a lot of defaulting that can happen in the beginning. Unfortunately, as I said, that puts you at a worse off position if you're not attending to it. But also there's a lot of stigma and stereotypes around the diagnosis or being diagnosed. And it's not just from society or the public. People themselves also judge themselves for being diagnosed with depression or whatever it is that they diagnosed with. So it becomes very sad because then, people don't seek help until it's really, 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 there's been a lot that has been happening, or unless they're at a very chronic state.
After the break, we hear from our expert and continue our health check-in with our mental health patient.
And I believe in this journey, in all of these years, your daughter was born. What year was this?
2009.
2009. So just before that
ever happened
last episode.
Yeah, she was born in 2009. And where the worst episode, I would say, would be the 2010, because then the 2011 episode happens now to be the last one, but I consider it not as bad as the 2010 one. But I do remember my sister, the very one here, she was not living here at the time, she called my resident psychologist, because we were friends, to say, is there something in UNISA? So they intercepted my trip and they took me back. That's when it became almost physical with my sister, because she didn't understand. She would be like, what the hell are you doing? Embarrassing me in front of everybody, that whole drama. So luckily then she drove me back. The one thing that she mentioned was that on the way back, I was singing my lungs out. So then she drove me home. Then when we got home, the other thing that my mom could see something is not right. Now, with my mom, when I'm not okay, then I would somehow be triggering her. So that's when then they would get the security guards, probably 3 to 4 of them pinning me down to inject me. So, yeah.
So I'm sure you've developed some techniques over the years on how to manage yourself. Like you mentioned, you have your self-soothing where you calm yourself down. What are the things that you try and do besides taking your medication to keep yourself well physically and mentally?
I am very proud to say I went on a 30-kilo walk last week. So when I finished it, thank you very much.
Congratulations.
But this is me. This is what I do. When trees rattle like this, when the wind blows like this, I have a colleague who calls me, is it a dendrophile? I don't know, but somebody who loves trees. So much that when you check in my status, this is my happy place. I have a particular tree.
That's lovely. And that's working for you, so that's good.
Yes.
Exercise will come later. So I can see that you're a strong mental health advocate and you love sharing about your condition and speaking to others. And we understand you have a TikTok page. Can you tell us a bit about that?
I do. My daughter helped me put it up. After my sister, like I said, my sister who said you could help a lot of people with this thing. So that's how we opened up the page. So I'm looking to venture into other platforms. But for now, it's the TikTok where I get to talk about my experiences. I talk about bipolar. I have this one topic that will raise eyes where I spoke about hypersexuality.
Ooh, it's a good one.
Because I happened to experience it not so long ago. But the handle itself, it's could be, like it would be CUD, like could, apostrophe, B, like the be the insect, but basically it says it could be you, it could be your sister, it could be your mom, it could be anybody, as much as it is me who's decided to be, could it be the face of mental health. So that's what my TikTok handle is called.
Thank you so much for sharing. Your story is very inspirational, and I'm sure a lot of people can relate, and a lot of people see that there's hope at the end of the tunnel.
You're most welcome. It's a pleasure to do this. I'm honored.
Mental health stigma has definitely had an impact on the Jiga family, and this has made for a tough journey. But Nongaba has shown that diagnosis and treatment are vital for a better future.
Welcome back. Described by some as having an overwhelming joy, excitement, or happiness, huge energy, a reduced need for sleep, and reduced inhibitions, these manic high energy episodes can last for days, weeks, or sometimes even months. Yeah, so certain stereotypes like, males feeling, this macho feeling that, they're stronger and therefore they don't develop, mental health illnesses.
Yes, and yet they have a brain with brain chemistry and some are predisposed to it genetically, never mind, and they're going through, they're human beings. So I think that's where the education, so that people seek help is really, really needed.
But other than social, environmental, economic type of issues, how much of a role do they play in development of these mental health conditions?
Of course, I mean, if someone is stressed and the stress is ongoing, that will definitely put one at a higher risk to develop mental illness, whatever type, right? And it might start firstly as adjustment disorder, for example, where someone is just struggling, but it's not full-blown depression, and it might actually develop into that, just depending on the context. As I said, some people are more resilient than others, but it doesn't mean that the people who are resilient don't have other issues, although they don't struggle with other things. I think it's important how you wired, but also the context of each individual that is diagnosed.
So linking up to then early diagnosis, obviously we said, and again we're repeating this because it's very important.
It is, yeah.
The role that family and those close to anyone who might be starting to suffer from, some of these illnesses, what role do they play and what should they be looking out for that will say, hey, this person needs help?
Changes in behavior, such as appetite, even substance use. And substance is not just alcohol or drugs, sometimes medication, self-medication. People are taking now Grandpa or Panado more often than they should. It's almost like they cannot live without just having a Panado, for example, or just sleeping habits, and also just the mood. Right? Some people who were maybe outgoing are now more reserved, or people who were reserved who are now just outgoing, or doing just a change in behavior. I think that's always the biggest one. But also sleeping habits, right? And also the people that they associate with, just to change actions or your reactions, and also just how they respond to you. As the family member. But it's also important to note that with mental health illness, that one must want the help. Right? They must want the help for them to benefit from the help.
Just your final words around managing patients with bipolar disorder. Is there hope for sufferers of bipolar disorder?
Definitely, with management. And the first rule is just that to accept that this thing I'm diagnosed with, and I need to work through it, and I need to do what it is that is needed to manage it. I think that constant reflection, that it doesn't mean that there's something wrong with you. Right? It just means that you were predisposed to this and you are diagnosed with this, but there is help out there. But you must take responsibility.
Indeed.
Right? You must take responsibility for your journey of healing.
Absolutely.
Right? And educating people about your illness. But we are also there to help.
Bipolar disorder is clearly a silent mental illness that is impacting millions of South Africans. It's also evident that workspaces need to adjust accordingly, not only during Mental Health Awareness Month, but every other day of the year. We hope that Health Check has helped you check in with your mental health. Should you know someone who might be battling with any mental health condition, please reach out to us on our social media pages and tell us your story. We're at Health Check SA on all social media pages. And until then, stay healthy, stay vibrant, and check in on your health.